Good afternoon and welcome to the two-part webinar series on early developmental screenings and resources. Today, your presenters will highlight information and resources that are available for parents, caregivers, and professionals when there are developmental concerns. I am Jeanette Mejias, and I'm the Director of Special Education Volunteer Advocates with SPAN Parent Advocacy Network, and I'm also the Family Support Integration Specialist with Family to Family Health Information Center. I will be your moderator for this session. The phones have been muted throughout the presentation, but we do encourage that you use the chat box for any comments or questions. We will extend the time just a few minutes, so if you need to leave the session, that will be perfectly fine, and we will go ahead and share those slides, recordings, and evaluations on both sessions. Casey Dudley, who's also with SPAN Parent Advocacy Network, will be monitoring the chat box and answering your questions. Before I turn over the session to our presenters, I'd like to give you information and an overview about SPAN Parent Advocacy Network. SPAN is a family-centered, parent-led organization that seeks to provide information, resources, support, and leadership development to families in New Jersey. Our work is focused on the areas of education and early intervention, health and mental health, leadership, children and family, and human services. We house programs and projects across the lifespan, including Family to Family, Family Voices, Federation for Children's Mental Health, Parent Training and Information Center, Inclusive Child Care Project, Parent to Parent, and a myriad of others solely focus on increasing advocacy skills, leadership development, and collaboration of families and professionals across systems and programs. To learn more about our organization, you can refer to the Ask for Help SPAN brochure or by visiting our website at www.spanadvocacy.org. I'm trying to move the PowerPoint, so bear with me. Okay, hang on one second. I apologize for that. Yeah, we're not moving the presentation. Hang on one second.
Deepa, please advance the slides.
Yes, if we can advance the slides. I don't have that capacity on my end. That'd be great. In the meantime,
this is Deepa. I'm having some technical difficulty. I'm just trying to work it. Please bear with me.
Okay.
Sure. Okay, no problem.
So keep going.
All right, so while Deepa is working on our technical area here, today you're going to hear from our presenters, Mercedes Rosa, who's a director of Family Health Information Center, Denise Boyer Hargrove, who is a director of the New Jersey Inclusive Project, and Deepa Srinivasan. Sorry about that, Deepa. I know I butchered your last name, who's the Act Early Ambassador of New Jersey. I am really honored and have the privilege to work alongside these women who bring a wealth of knowledge as they've navigated these programs and supports that they're about to share, and also their lived experiences. But most importantly, they bring passion to the work and really are incredible and amazing servant leaders. So without further ado, I'm going to go ahead and turn it over to Mercedes Rosa. Mercedes?
Thank you, Jeanette. So when we think about linking families to supports and services, it really all comes down to what is a medical home. We talked a lot about that at the last presentation when Jeanette Mejia shared her story and Dr. Jimenez really framed connecting families to developmental screening and monitoring. So what is a medical home? A medical home is not only a place. A medical home is an approach to providing comprehensive primary care that facilitates partnership between patients, clinicians, medical staff, and families. It is a medical practice organized to produce higher quality and improve cost. In a medical home, patients have a relationship with the team and the primary care physician. The primary care practice takes collective responsibility for the patient's ongoing care. Patients can expect that care is coordinated across care settings and disciplines. The medical home provides a large majority of care within the practice, referring as appropriate and working with other providers on healthcare, both within and outside the practice. Within a medical home, care should be accessible, care that is easy for the child and the family to obtain, including geographic access, insurance, payment accommodations. It should be family-centered, where the family is recognized as the primary caregiver and support for the child, ensuring that all medical decisions are made in a primary partnership with the family. It should be comprehensive and include primary, preventative, and specialty care. Care should be coordinated. A shared plan of care or a care map should be created in partnership with the family and communicated with all healthcare clinicians, community agencies, and those involved in the care of the child. It should be compassionate. There should be a genuine concern for the well-being of the child, and the family is emphasized throughout. It should also be culturally competent, effective, and culturally responsive. The family and child's culture, language, beliefs, and traditions are recognized, valued, and respected. It's a place where you go for your checkups, your well visits, sick, accidents, special health, immunizations, and screenings. And the benefits are that they really get to know your family. It focuses on preventative care, early screening, early intervention, referrals to specialists, and community supports. So what is a medical home neighborhood? In a medical home approach, developmental monitoring and screening includes the following: identifying children diagnosed with a developmental delay, as well as children with a special healthcare need and managing their care. Coordinating with specialists about additional evaluations that the child may need. Monitoring progress, interventions, therapies, and treatments. Also integrating feedback from early childhood providers who can monitor and screen the child in the early childhood setting. A medical home neighborhood is a clinical community partnership that includes medical, social supports, and is necessary to really enhance health outcomes. These various medical home neighbors work together in tandem to encourage the flow of information across and between systems, clinicians, patients, and include specialists, hospital, home health, and clinical providers. So if you're a parent and you're concerned about your child's development, like me, I have two children with autism spectrum. They're now adults. My daughter is 22 and I have a 19-year-old in college. If you have concerns about your child's development and you see red flags, go ahead and schedule an appointment with your pediatrician right away. You can contact early intervention. You don't need a referral to contact early intervention. Schedule a screening. We talked about a myriad of screening tools that will help the doctor identify at-risk or developmental disabilities within your child. Most of these screening tools are quick, straightforward, and consist of yes or no answers and a checklist. As far as the symptoms go ahead and seek out early intervention. Note, early intervention. The earlier you connect to services, the earlier your child will be seen and receive services. Go ahead and get that referral to see a specialist. If your pediatrician detects signs of a developmental delay or autism, they will recommend additional screening. So this is often a question that is a little bit daunting to families. They really want to know how a diagnosis is made. So a diagnosis of a developmental delay in autism involves two steps. Step number one, it involves a developmental screening, and we talked a lot about that on the last session, so I'll just repass to give an overview. And two, a comprehensive diagnostic evaluation. So what happens during a developmental screening? When additional screening might be needed, and especially if a child is at risk for developmental problems due to preterm birth, low birth weight, other reasons like genetics within families, children should be screened specifically for developmental delays and autism during regular child visits, 18 months, 24 months, and also 9 months. Additional screenings might be needed if the child is at risk for ASD, has a brother, a sibling, or a family with a developmental delay, or if behavior sometimes associated with autism spectrum disorders are present. If your doctor does not routinely check your child for this type of developmental delays, you can go ahead and ask. It is your right within a patient-centered medical home to have these screenings and monitoring done on a regular basis. Now, if the doctor sees a problem, he might go ahead and recommend a comprehensive diagnostic evaluation, but at any point you feel that it's needed, you as the driver of your child's care can go ahead and ask for that. These evidence-based screening tools include parent reports that can help healthcare providers talk about the child's development in a systematic way. And when you're seeking out additional evaluations, it could be with a developmental pediatrician. Now, if you're a professional, listening to this webinar, this is a very daunting process for parents, and they really need to be informed throughout the process and have that ongoing support. Having a child with a developmental delay or failing a screen can really be disheartening to parents, and they really don't know, what to do or what to expect. So the more you can walk them through this process, it will be empowering, and they will be able to respond and be proactive with whatever the outcome. They will have the same child that they walked into the screening with. So these are some of the screening tools that might be used during a developmental screening, and it's not an exhaustive list, and the CDC does not approve or endorse any specific type of screening tool, but these are some of the more common ones that are used, and there are many that can be added to this list. Next slide. What happens during a comprehensive diagnostic evaluation? This is the second step in a diagnosis, and it may involve looking at your child's behavior and development, interviewing parents. I know when my children were diagnosed, it seemed like the never-ending questions about my pregnancy. So if you're a parent on the line, yes, they will ask you a lot of questions about your medical history. It may also be comprised of an interdisciplinary team that might include hearing, vision screening, speech and language assessments, some genetic testing if appropriate, neurological testing, and other medical testing as well. Your child may see a developmental pediatrician who is trained, and also a psychologist who is trained, in this area. Most of the assessment might be direct observation by a team, administrating different assessment tools. It could be the MChat, and one of the assessments that were there, they're looking at your child's social and communication. They're looking at your child's behavior. Much of it might be, observing them. It might be 1 day, 2 hours, or it can be done over a period of visits. So again, the more you prepare families for this process, and again, it could depend. It could be 1 hour and a half, 4 hours or longer. It could be 1 day or over a number of visits. So the more you prepare a family for this process and to be able to begin to share this information, they will get a quick diagnosis and be connected to the right services. And again, connection to early intervention does not have to wait until this comprehensive assessment takes place. So now at this point of the webinar, I'm going to turn it over to Denise, who's really going to talk about connecting families and children to services within the preschool setting.
Thank you, Mercedes. Good afternoon, everybody. I appreciate you taking the time to sit in on this webinar today because it's a wealth of information that's very useful for parents as well as professionals. As a director for the New Jersey Inclusive Childcare Project, one of our goals is to help childcare providers and education professionals to understand that inclusion is a right, and that in knowing that there are policies and practices and procedures that need to be put in place so that children can be included within typical environments. Our philosophy is that a child belongs wherever any other child would be. So with that, I'm going to tell you a little bit about some of the information that we provide to childcare providers as well as families to help ensure that children are included on every level from birth to age 21. So next slide, please, Deepa. So one of the reasons why children are included is not just because it's the right thing to do, but there are also laws that support the inclusion of children who have special needs. And this is not an exhaustive list of the laws that pertains to children who may have special needs that are identified through screenings. And I'm going to talk a little bit about that a little bit later. But I just want to first, educate you about some of the laws that have specific rights that address the needs of children who have special needs and procedural safeguards for their families, meaning that certain policies and practices need to take place when children have been identified as having special needs through screenings, through assessments or evaluations that parents need to be very much aware of. So there's the Americans with Disabilities Act. It really is the public accommodation laws that basically says any program that opens themselves up to the public must make reasonable accommodations and modifications within their program for children who have been identified as having a disability, who are suspected of having a disability, or those who has had a disability and that disability is now in remission. And then there's 504, the Vocational Rehabilitation Act and Child Care, because ADA is such a large law that it covers everything. It covers government agencies, schools, private placements, and so forth, that there's a particular section within ADA that addresses childcare. And that means that any program that is receiving public funds, whether it's through a stipend or whether it's through subsidies or in-kind support, they must make reasonable accommodations and modifications to their programs in order to receive those federal fundings. One good example of that are Head Start programs. So Head Start programs' philosophy is they do not expel children from their programs. They make accommodations and modifications within their schedules and routines for all children of different abilities. Then there's IDEA, the Individuals with Disabilities Education Act. And I'm going to primarily talk about parts C and B. There are 4 parts to this law, but the important thing to remember about IDEA is that it comes along with funding. There were laws before IDEA, but this particular law in 1997 provided funding to states so that programs like early intervention could be implemented and programs like special education services could be implemented. And I'll talk a little bit about how those are affected by screening and what it is important for families to know to make sure that their rights with these laws are, are respected. And then the last part are New Jersey laws against discrimination. While the 4 previous laws that I mentioned, they have very strict guidelines and procedural safeguards that protect families and children's rights. New Jersey laws against discrimination go further than the federal law. So we have a lot of great protection here in New Jersey that helps support our rights and protect our children's rights. Next slide, please, Deepa. So next I want to talk to you about, can you go to the next slide, Deepa, please? Okay, thank you. So this chart will help you. I'm going to breeze through these next 2 charts pretty quickly. You can go back. So this chart here, the first chart, helps you to understand the laws a little bit better. Okay, so it talks about what ADA is responsible for, what IDEA is responsible for. And this chart here talks about which agencies are responsible for what. So for preschool, that's children who are between 3 and 5. The lead agency for preschoolers is the State Department of Education. And for infants and toddlers, it's the Department of Health. And the person that leads those agencies is appointed by the governor. So when it comes to transition, that means from infants and toddlers to the preschool program, it is the responsibility of the Department of Health to make sure that those children have a service coordinator who will help families understand how to facilitate transitions from those different departments. And each orientation is different, meaning that when it comes to infants and toddlers, the Department of Health is really, really focused on family-centered practices, services that support the whole family as well as the child. Whereas during the preschool years, the orientation, the focus is on the developmental learning. The Department of Education wants to focus on helping this child to acquire as much information as they can that supports their development and learning. Next slide, please, Deepa. Okay, so Mercedes had talked about screening. So very quickly, one of the important things about screening, why screening is so important, is that screening leads to assessment, which leads to evaluation. And children, unless they are screened, unless there's ongoing screening to determine if there's any developmental concerns, then a child may not even know that they have, a parent may not even know that their child has a developmental concern. So screening is important in that it leads to a much larger set of services that a child could be eligible for. Next slide, please. So in the next slide, you see the stages of assessment process. So you will see that once children are screened and they have been identified as needing support so that there's developmental concerns, parents or providers can contact Child Find, which will help families locate where the services are. And depending upon the age of the child, if the child is birth to, let's say, 2 years and 10 months, they could be referred to early intervention for an evaluation to see if they're eligible for services. Or if they're after 2 years old, they could be referred directly to the Department of Education to determine if they're eligible for services through that department. But it leads to a larger set of processes that leads to evaluation to determine if children are eligible for an individual service plan through early intervention or an individualized education plan through the Department of Education. The next slide, Deepa. So for those of you who are not familiar with early intervention provides services to children birth to 3 who may be suspected of having a developmental delay. So one of the processes of them doing this is to first do a screening and then to determine whether that child should go for an assessment to see if there are developmental delays that would put this child in a position to be eligible. Now, there are many children who one may think may be eligible for services may not be eligible because early intervention has a pretty high bar in order to say a child has a developmental concern. So if you want to know a little bit more about what that evaluation process is, then we have information at the project as well as at SPAN that can give you that. So I will just ask everyone to mute their lines because I'm hearing some background noise from others. So if everyone could just make sure your lines are muted so others can hear the presentation. So next slide, Deepa, please. So early intervention is part of IDEA, is part C of IDEA. And these are funds, like I said, that comes from the federal government to help the states to perform evaluations and assign service coordinators to family. So early intervention helps children who have developmental delays in that it helps them with some physical activities like rolling over and crawling. It helps them with cognitive issues as far as thinking and problem solving. So many children who have developmental delays, they have deficits in these areas of the domain, like physical, cognitive, it could be communicative, it could be social, emotional, it could even be self-help skills such as feeding or eating. So early intervention would create, with the parents' input, of course, would create a plan that's specifically for that family that will help that family to help their child with developmental concerns. So some of you may not realize that a child who has a developmental concern might be eligible for these services. So that's why screening is so very important. And you can contact the early intervention. We have the early intervention contact information here on this slides. And as Mercedes said earlier, you will receive a copy of these slides so you can reference them later. So in putting a plan together, next slide, Deepa, I'm sorry, please. So in putting a plan together, I want you to know who is involved in helping families create these plans, because oftentimes, if families get the news that their child was screened and there was a developmental concern there that needs to be addressed, sometimes families don't know who to turn to, who to talk to. So here's a list of professionals and individuals who could be included in the discussion to help the families to create a plan that's unique and that's right for their child. So, and this list isn't exhaustive. It could be someone such as a close family friend who has helped the family to take care of the child. It could be a child care provider where the child, let's say, is 6 months old, but they're in a child care program, and the families may feel that this individual have inside information as to the development of their child that they feel is critical for early intervention to know about. That person could be invited to be a part of this conversation as well. Next slide, please, Deepa. So in eligibility, in very general terms, because until a child has been assessed and an evaluation has been completed, only then can you tell if a child is eligible for services. But there are certain conditions that are present at birth that makes a child eligible for early intervention services, and you will see them here listed on this slide. And oftentimes there may be children whose eligibility may not be determined until they have had a screening. So that's why screening is important, and screenings can begin at as early as 9 months. And screening is not as difficult as some may think it is. We do screenings all the time with young children. So if we happen to go into a child care program and we see a child who's 9 months old in the child care program and they're not able to hold their own bottle, they're not making any efforts to try to walk or crawl up or pull up, or, those gross motor skills that we know that 9-month-olds do, we do a quick screening just in that instance and saying that we think that there's some red flags. So in doing that, that leads to us doing a formal screening. And then with that, that may lead to a referral to early intervention or to Project Child Find. But in order to determine eligibility, there is a criteria that early intervention has, and that is a child must be delayed at least 2 standard deviations in one area of domain. Those domains that I mentioned earlier, like cognitive, physical, social, emotional, communicative, or they must have a delay in 1.5 standard deviations in 2 areas of domain. So if you feel that your child may be eligible for these services, then it's best to speak to a service coordinator or someone at early intervention who can give you a little bit more insight into what goes into determining who's eligible. So next slide, Deepa. So there are some categories at risk that families need to know about and that child care providers are learning about, and that is children who have established risk, like children who are born and they have certain risk factors that can make them eligible for early intervention. Then there are biological risks, and these are children who have been diagnosed with physical or mental conditions that has a high probability of resulting in a developmental delay. And then there are environmental risks. So environmental risk category includes children who are biologically sound, but whose early life experiences may have been so limiting that their impact has a high probability on this child having developmental concerns. So of these 3 categories of risk, it can only be determined through a screening or an evaluation. So next slide, Deepa, please. So in the referral process, so this is just another quick look at how the referral process to early intervention works. First, an intake is done at the early intervention office or through Project Child Find, which is a statewide effort to help the state identify which children may be entitled or eligible for special education or early intervention. So an intake is conducted, and with the parents' permission, a developmental evaluation is done. Now, parents have the right to refuse or they can consent, but all of this is part of the process. The developmental evaluation is done, and then eligibility is determined. Now, as I said earlier, some children are not eligible. So if parents feel that their child should be eligible and they're determined not to be eligible, there is a due process procedure that parents could take to appeal that decision. But if, say, the child is eligible for the services, then an IFSP is developed, an individualized family service plan or family support plan is created. And then within 45 days of signing the consent children are provided services, okay? So with the IFSP, it's an individualized family service plan, and it's unique to that family, and it outlines all of the early intervention services the child may be eligible for. So next slide, please, Deepa. So the IFSP, the Individualized Family Service Plan, these are some of the criteria that is included in the IFSP. There's information about the family demographics, such as if the child has siblings or if the child is an only child, if they're a middle child. That information is important because for children who have siblings, then you want to make sure that the siblings are included in the plan, because every interaction within the family helps to go towards that child's development. It also includes whether services will take place, where they will take place, whether they'll take place in the home or what we call natural environments, whether they'll take place in the home or the library or the child care program. It also spell out who will pay for the services, because there is a small cost sharing component to early intervention services for some families, not for all families, but for some families who are of a higher social economic scale may have to pay a small fee, okay? But for most families, there is no cost sharing part to early intervention. And the IFSP is reviewed every 6 months and is updated annually, okay? Next slide, Deepa. So in addition to that, here are some additional services that a child receiving early intervention might be entitled to. And again, this list is not exhaustive of all of the services that is available, but these are some ideas of the different categories of services that a child could be eligible for. Now, for children who are 2 years old to, I'll say 21, but within my project, the population we work with is from children up to age 13, and who may be eligible for services. They will qualify for services under IDEA Part B. That's the Individualized Education Act Part B. And they will be entitled to receive special services under special education. So children can be referred to the special education department, usually the child study team at the local school district. Children can be referred to the child study team as early as age 2. And at age 2, they can be evaluated to determine if they're eligible for services. And their services would begin at age 2.5 to 3 years old. When the child turns 3, the IEP, the Individualized Education Plan, begins at that point. Okay, so children can be found eligible as early as age 2, and then the IEP will take effect as soon as they turn 3. Okay, so with the Individualized Education Plan, it's very similar. The process is very similar to early intervention in that there's a process that goes into becoming eligible for these services. So Deepa, next slide, please. I'm on the special education delivery cycle. So you will see here that step 1 is identification. So the same identification process that children who receive early intervention, it's the same similar process in special education. First, a screening must be done to identify if the child should be referred. That goes into identification, in identifying if a child may be eligible. Then step 2, parents would give consent if they want their child eligible, or they want their child evaluated to determine if they're eligible. And step 3, all of the evaluations must be conducted within 60 days of the parents signing consent. Then the parents are given the copies of these evaluations. A meeting is held. And step 4, and at that meeting, the child will either be determined eligible or ineligible. And the same process, if there's an ineligibility status given to the child, parents do have the right to a due process to appeal that. And then an IEP is developed within 30 days of determining eligibility. Sometimes the IEP is developed right then and there at the same meeting. Then the IEP is implemented within 90 days from the parent's signature, and then the IEP is monitored to make sure that all of the goals and objectives and all of the services are adequate enough to meet the needs of the child. And then step 6, this IEP is reviewed annually, and changes are expected to happen because we expect children to make progress within their IEP. So there could be some small changes or minor changes to the IEP for the coming year. So I won't get too bogged down into this discussion because that is a lengthy discussion. We at SPAN have workshops and trainings that are like 2 days, 3 days long. So I won't get into all the particular, but each one of these steps, parents have very specific rights in the law as it pertains to evaluations and screening and assessment, because evaluation, screening, and assessment should be ongoing processes within the IEP, for a child within the school year. Okay, so next slide, Deepa. So if you want more information, I know I'm hitting on a lot of things at once, but I want you to see how important screening is and how important it is to know about the different processes that happens after screening, that, you know, the different types of services that you could be eligible or your child could be eligible for based upon a screening. Okay, so next slide, Deepa. So when children are found eligible for services, special education services, these are some of the eligibility categories. Children are not labeled, but they are determined eligible based on the category that the evaluation provides to the evaluator. For instance, a child who is 3 years old could be eligible for speech language services alone. There doesn't have to be any other criteria. So a child, let's say, who is autistic, they will qualify for special education services based on the criteria of autistic. They may also have speech language concerns. They may also have other types of concerns. But if they're 3 years old, they will fall into one of these eligibility category, and they will be entitled to services based on the fact that they are a preschooler with a disability. So most preschoolers from 3 to 5, they receive the eligibility category of preschool disabled. Or if the child has communication deficits, they could receive special education just on speech alone. Again, this is a much broader topic than I can get into in depth with you, but I want you to know about these things because you can always research them on your own, or you can always call us at SPAN. We'll be glad to give you additional information on them. So next slide, please, Deepa. So the next slide really talks about preschool disabled. Who are the preschool disabled? They are the young toddlers or the young preschoolers who are between the ages of 3 and 5. And they are viewed as young children who could be typically developing, but they need a little bit extra support. Or they could be young children who need a little bit more support, and they qualify for special education services and receive an IEP, an individualized education plan, that gives the teacher specific instructions on how to educate and how to care for this child. Okay, so in order to have an IEP, so these are some of the components. Next slide, please, Deepa. So these are some of the components of an IEP. So the IEP contains the present level of education performance, which should be based on a screening. So in order for an educator to say, a preschooler, let's say, knows their ABCs, a preschooler has the skills acquired to read, or they have the skills to do math. That is included in what we call the present levels of education performance. And that's important because many times it's a professional in the child care or the preschool classroom that should write this, because this is a person who has been viewing the child, has been observing the child, has been a part of the child's learning environment, and knows the skill levels and the needs of this child. So that person should be the one to write up the present level of education performance. Then goals are determined to help fill in the gaps. So if a child is not able to recite all of their ABCs or write their name and address completely or know their phone number, those should be short-term goals that are placed in an IEP. And then whatever supports the child needs, like let's say if they need a slant board in order to write their name properly because they need to have stability for their arms or whatever the case may be, or if the child has a short attention span, what type of supports or modifications or services need to be put in place to help that child. And the last thing, there should be a way to measure the child's progress. So it really is semantics here, because when we talk about measuring a child progress, we're actually talking about really doing an informal screening, because you want to see that the child is making progress based on the goals that we've set for them. So in doing that, the teachers have to have a way to measure the child's progress and to assess the child as they go through the IEP for that year. Okay, so that's really how the IEP is developed. It's developed looking at the student's need from the present level of performance, the present levels of education performance, creating measurable goals, short-term goals to help the child to meet the needs and understand the instructional content of the class, and then modifications and related services to provide access for the child to be in the general education curriculum. If that is the case, then what type of supports and modifications do we need to add to this curriculum in order for the child to access it, and so it to be individualized. That's the key, is that it has to be individualized for the unique needs of the student. And then how can we tell if these goals are working and the child is making progress? Okay, so next slide, Deepa. So in measuring and monitoring the child's progress, we create and develop goals and objectives for the child. And these are some of the things to keep in mind when we want to develop goals and objectives for children who are preschoolers or children who are in K through 12 placement. So we always want to keep in mind that there's a socialization component. We want to look at what is not only chronologically age appropriate, but what is developmentally appropriate. Because just because a child has a certain age, let's say of 10 years old, doesn't necessarily mean that they have the social emotional skill set of a 10-year-old. So the goals can look at a variety of things. The goals can look at socialization, they can look at academics, it can look at recreational. So the IEP is a much more comprehensive document that looks at all the areas that can affect a child's development. So these are just some things to keep in mind when developing the goals. Next slide, please, Deepa. So in special education and related services and supports and services, all of these should be components that help the child to advance through their goal and to meet the needs of the general education curriculum and make progress within the general education curriculum. And as I said earlier, it should also look at extracurricular activities and non-academic activities, those socialization components that also goes into the child's development, because these things can be screened out. You can screen and tell if a child has some social emotional deficits that if they're placed in a certain environment will help them to build the skills that they need to socialize, okay? So we want to keep that in mind, that when we educate children who have an IEP, we want them to be educated and to participate in all of the academic and extracurricular activities at a given school, okay, that they have an interest in. And these are some other related services. So the related services I mentioned earlier, next slide, please, Deepa, on related services. So earlier I had mentioned some related services that are part of creating an IFSP, Individualized Family Service Plan. Those are true of a special education plan as well. And in addition to those, these are some other related services that children who have an IEP could be found eligible for, such as transportation. And then there are others like speech and language pathology and audiology services and psychological services and some other services that I have listed here. Even services for parent counseling and training so that parents can learn a little bit more, let's say, about certain, learn more about how to help children make progress towards their goals and objectives. Okay. Next slide. In addition, one other thing I wanted to talk to you about is that another related service, and I don't think is listed here, is that parents can ask for consultative services. So let's say if a teacher is not familiar with how to differentiate instructions or how to modify their own curriculum for a particular child, parents can ask that that teacher receive a particular in-service or consultative services to help support her in a classroom so she can help support that child. Next slide, please, Deepa. So in addition, these are some other support services and resources that you might find useful. Of course, SPAN, we provide a wealth of information to parents and professionals around key information around early intervention services and special education services. The Division for Early Childhood Education, they are a renowned research organization that provide evidence-based practices on working with children who have special needs and disabilities. There's additional information on the law that you can access through Rights Law, and I have the web address here for you. And in addition, there's information that if you wanted to learn more about IDEA services, early intervention, as well as special education, you can go onto the U.S. Department of Education's website that I have listed here. And in preparing this portion of the presentation for you, these are some additional resources that you might find helpful. There's information at the Parent Hub that gives you more details about early intervention and an overview of that entire system and the services they offer. You can learn more about screening, evaluation, and assessment through the Early Technical Assistance Center. They are also a research organization that has printed much information on screening and evaluation. There are even tools on that website. Mercedes had talked about some of the different types of screening tools like ages and stages. You can find additional information on those at this particular website. And then there's other information here from the American Psychiatric Association on diagnostic and statistical manual mental disorders if you want to learn a little bit more about mental health issues that may mean that a child is entitled or eligible for special education services as well. Okay, and if you want to reach out to the project, if you have a child who's in an early care placement or an after-school placement, and you need a little bit more support or information on the services that we offer to those programs, please reach out to us at the New Jersey Inclusive Child Care Project at either one of these numbers or our email or web address. Okay, so I thank you all for your patience in listening to me. And now I would like to turn the remaining of the presentation over to Deepa S. I'm not even going to begin to pronounce your last name, Deepa. I apologize, but I don't want to mess it up. So if you can just introduce yourself to everyone, please. I'm sure they would appreciate it. And I'll turn this over to Deepa. Thank you all.
Thank you, Denise, for that wonderful session about all the information and resources through the New Jersey Inclusive Childcare Project that is available for families and professionals. Hello, everyone. My name is Deepa Srinivasavaradhan, and I am the Learn the Science Actually Ambassador to New Jersey. Learn the Science Actually is a program of the Centers for Disease Control and Prevention. It aims to improve early identification of children with autism and other developmental disabilities so children and families can get the services and support they need as early as possible. This program includes a health education campaign to promote awareness of healthy developmental milestones, the importance of tracking them, and acting early if there are concerns. It also includes ambassadors in all states and territories to promote awareness. As New Jersey's Actually Ambassador, I promote the program and provide messages and tools to help families and professionals connect to vital resources and supports to improve early identification efforts in our state. This includes not only connecting families to early intervention, but also to other support resources, including Parent Training Information Center and Family-to-Family Health Information Centers, which exist in every state and are staffed by families who themselves are parents of children with special needs, so they can provide peer-to-peer support to families. In New Jersey, SPAN houses the Parent Training Information Center and Family-to-Family Health Information Center. This is an important support for all families, but especially for families from diverse racial and cultural backgrounds or with limited literacy. CDC, in conjunction with the American Academy of Pediatrics, has developed materials to help educate families about developmental milestones, including what to expect and when to be concerned about their child's development. These materials are not a replacement for developmental screening, but they help parents to be better informed partners in monitoring their child's early development. With these resources, parents can base their observations on objective, research-based, age-appropriate developmental milestones. As professionals, encouraging parents is important. Please encourage parents to use these materials. When you share resources with families, tell them to use the resources by letting them know how easy it is to use, what the resource does, and how they can use it. Parents who are familiar with developmental milestones for their child's age might be better able to complete parent questionnaires that are part of routine developmental screening. They help parents have more realistic expectations about their child's development. If you already have resources you like to use, these materials can supplement them or fill the gaps. They use parent-friendly language and have been tested and are well received by families. The content is provided by CDC and AAP, so you can have the confidence in their accuracy and credibility. The Watch Me training is a training offered, again, by the CDC's Act Early program. Early childhood professionals play a critical role in health and well-being of children. They are also well-positioned to help identify children who might need extra help in their development. This free online training course called Watch Me, Celebrating Milestones and Sharing Concerns helps them fulfill this role by providing tools and best practices for working with families they serve to help them monitor their child's development. So the next one is a flowchart that was developed specifically to help families with next steps on what to do when a child that screens positive for developmental concerns, and in particular autism. And it lists the key steps from referring to early intervention to specialists for further developmental evaluation and diagnosis, like Mercedes mentioned, and provide family with information about the early intervention process, and then connecting families to other resources in the state. These are county-specific flowcharts for families as well as for early childhood professionals who are supporting families to help navigate the different systems when developmental concerns are identified. So this flowchart provides information that can be used by families, and it is not necessarily a start to end flowchart. It lists all the different entry points for families and lists the key resources that would be helpful in monitoring and screening a child to receiving follow-up services and support. And this flowchart is available for all the 21 counties, and it is available on the Boggs Center website, which I will be sharing with you in the next couple of slides. This is also another flowchart that helps them provide the next steps for families when developmental concerns are identified. And this is more like a statewide flowchart of systems that is helpful for families to navigate. This flowchart is also available in Spanish and also hosted on the Boggs Center website. So I just mentioned about the Boggs Center. It is the New Jersey's federally designated University Center for Excellence in Developmental Disabilities Education, Research, and Service. And they also host the Learn the Science Act Early webpage for New Jersey. And I provided the link here on this slide that you can access to get access to all these resources in addition to the flowcharts that we just talked about. The next one is New Jersey Parent Link. It is New Jersey's Early Childhood Parenting and Professional Resource Center. And some of the resources that are available on this website are developmental information and activities for all ages, safety tips, nutrition and food assistance, childcare, parenting tips, income and housing assistance, medical insurance, etc. You will find a whole host of information on this website. The next one is Children's System of Care. Perform Care is the contracted service provider, and they offer services to children up to age 21 to make caring in the community easier. So some of the information provided are about behavioral services, respite care, camp funding, assistive technology, and as well as any modifications to the home and vehicle that may be needed. Next one is New Jersey Council on Developmental Disabilities. It is a policy and advocacy group that works to ensure that people with disabilities are empowered advocates. They support the partners in policy-making training, and they also organize the Regional Family Support Planning Council across the state. So now I would like to turn it over to Mercedes, who will provide an overview of a few resources.
Next slide, Deepa. The next resource we'd like to highlight is Special Child Health Services, county-based services. Case management is very unique to New Jersey, and I really love and have benefited greatly from the resource and referral they provide and connection and linkages to families. They also house early intervention services for children under 3 who have developmental delays or and need evaluation, assessment, in-home, community-based, and therapeutic services. And one of the wonderful things is that there's a social worker on staff there to provide emotional support and as well as linking families to community supports. Again, this is really unique to New Jersey as I travel, and other Department of Health don't offer this component, such a value add for families. Next slide. We also worked in tandem with our Department of Health and AAP on a project to develop a shared plan of care. And I mentioned earlier, the shared plan of care is a document that helps families organize their health records and keep track of their medical appointments, medication, communicate relevant information between those in the medical home neighborhood. On the Department of Health's website, there's also webinars that we did to really empower families and young adults to access these shared plans of care, to learn how to complete them. And again, the more we foster independence and self-direction with our young adults early. So just a great tool and a resource, along with webinars on how to connect families to that tool. Next slide. Family support organizations are wonderful and family-run based community organizations. They provide education, advocacy, and support to families, their support groups, and also resources and referrals. Family Success Centers, also funded through the Department of Children and Families, are a one-stop shop for families around wraparound services, resources, and supports to help families avoid a crisis. There are 2 or 3 per county. They do a lot of information on maternal child health, training on budgeting, nutrition, resume writing, interviewing skills, and housing, but they really try to empower the families. The Family Resource Network has timely webinars and serve as a clearinghouse both for information, national, state, and local partnerships for families. They help connect families with ABA services, recreational supports, summer camps, really a lot of support for caregivers and learning about disaster case management. Epilepsy Foundation is housed there, so they really do a lot of support and work around transition as well. Next slide. And New Jersey has an Autism Center of Excellence, which is part of Children's Specialized Hospital. So we're really proud to have this resource that has all of the information of what's going on research, funded projects, the data, and all about autism. So wonderful resource. And on the advisory council, there are also young adults with autism, and my son is part of that advisory. So very proud of our Center of Excellence in New Jersey. Next slide. Statewide Parent to Parent is a wonderful program organized through SPAN and funded through the Department of Health, in where we link a parent with another parent with lived experience that has gone through the journey to really foster that emotional support and connection for families, connecting them to vital resources. And again, when a child is diagnosed with a developmental delay or autism or any other condition, having another parent there to walk you through the process, both emotionally and substantively, to connect you to vital resources and just let you know what's coming next, is a valuable resource for families. Next slide. Mom to Mom is a 24/7 peer support, which is a wonderful, wonderful resource. They have a 24-hour hotline, support from another mom also raising a child with a disability. They assess caregivers for the stress levels associated with really having a child with a delay or developmental disability. They connect you to resources, information, and support. Two incredible programs, Parent to Parent and Mom to Mom. New Jersey is fortunate to have them both. Next slide. And again, support groups are so important for families around specific disabilities, but even within a group, we know technology now has connected families to support and services. Some are not able to leave their homes, so a lot of supports are online now, but these are some of the ones available in New Jersey around mental health, ADHD, parents of children with autism, and these again are just a few. If you're on the line and your resource is not listed and you would like it to be listed, please feel free to connect your contact information, and we'll be sure to add you to a resource list so that we can share your information with families as well. Next slide. And at this time, I'm going to turn it over to Deepa that's going to wrap up the webinar.
So on this slide, you will see the information about the New Jersey Department of Education. Denise shared earlier as well that you can find information about early intervention and preschool services. In addition, you can also find information about school performance, anti-bullying resources, and about the Learning Resource Centers, which are, again, great resources for families. The Center for Parent Information and Resources is a national project housed at SPAN that houses information and resources of interest to parents of children with and without disabilities. It is easily searchable. The website houses articles, publications, webinars, and resources, and it provides contact information for parent centers nationwide. So NJ is one-stop for families, is the Statewide Parent Advocacy Network. PAN should be a family's first stop when seeking assistance for their children with special needs. We can assist them in locating useful resources, identifying a workshop that will help them better understand an issue they're facing, and then information and fact sheets to support their efforts and ultimately help them build their parent leadership skills so they can assist other families. So these are some of the resources on the SPAN website. We have a promising practices for screening of autism and other developmental disabilities. Again, another webinar that was done previously. And New Jersey's child developmental passports. Those are invaluable tools for families to monitor and track their child's development. Raising awareness of child developmental milestones, Birth to 5 Watch Me Thrive resources. Again, great resources to monitor and track children, their child's development. So engaging families in early childhood initiatives is important. Families are powerful allies across systems. While serving them, professionals can also engage them to partner with them to enhance their programs and provide better services for all families. Families can connect with local community advocacy family organizations like SPAN Parent Advocacy Network to be engaged, educated, and empowered. So as we had mentioned previously, SPAN provides a lot of training and support for families to be effective and be engaged, educated, and empowered. So please connect with us for all that information. And some of the trainings One of the trainings that I would highlight is the Special Education Volunteer Advocates training, as well as the SPAN Resource Parent training, which are very comprehensive, in addition to the trainings provided through the New Jersey Inclusive Childcare Project. And that concludes our slides, and we will now take any questions for all the presenters. Casey, do we have any questions?
At the time, I don't see there are any questions in the chat box, unless anyone wants to unmute their lines and you are open to ask any one of our presenters a question, or if you'd like to state a comment, that would also be great too. Thank you. Okay, well, if there are no questions at this time, I would like to take the opportunity to thank you for joining our two-part webinar series. We know that there's such a vital importance to this topic, and you will receive the recording and all the materials that were shared at the end of the presentation. Thank you, everyone, and have a great day. This concludes the portion of our webinar. Thank you.